Welcome to Lotus Health Education and Wellness Empowerment through Health Enlightenment. One of the questions that we commonly get anytime we see patients in clinic is in reference to being diagnosed with what we refer to as a chronic health condition, meaning something that you're going to be diagnosed with and have to more than likely be treated for the remainder of your life. These could be things like high blood pressure, diabetes, other types of issues with your cardiovascular system, like for instance high cholesterol or certain things like that. And oftentimes when we talk to patients about the fact that we've reviewed labs and done other tests on them and determined that they have these particular conditions, one of the first questions that we get is, am I going to have to take medications, and will these medications just help take care of whatever it is and I'll be better? The answer to that is never really a simple yes or no. There are medications that will definitely help, but as we discussed on this channel, one of the big things that we want to encourage is not just taking medications, which are absolutely important and something that if you are prescribed them, you should definitely make sure that you take them just the way that you discussed with your healthcare team. But in addition to that, you'll also often hear us talk about something called lifestyle modifications, which are basically the things that you do in your everyday routine to make sure that you're being as healthy as possible. And in the case of when you have certain health conditions, that you're doing everything that you can to try and keep all of the different factors that could make that health condition worse under control. Part of that can be taking medications, but like we've talked about on this channel with regards to non-medication related things, we also want to look at your diet. So today we're going to take a look at patients that are diagnosed with high blood pressure, also known more technically as hypertension, and a diet called the DASH diet that you can try to integrate into your routine to help make sure you stay healthy and also get you the best outcomes that you can with your particular condition. So let's take a little closer look at the DASH diet. When most people hear about the DASH diet, healthcare professionals included, one of the biggest things that they'll often think of is this: salt. So it is true that with regards to the DASH diet, it is important for you to be mindful about your salt intake. Typically, I'll get the question a lot from patients anytime we're talking to them about the fact that they have high blood pressure, certain things they need to do, and especially if they're on medications, I'll often get questions from them about how much salt it is that they should be taking. The healthy amount, if there is a way to refer to it like that, according to the American Heart Association, is anywhere from 1,500 milligrams of salt to 2,300 milligrams of salt per day. In other words, you really shouldn't be consuming more than about 2,300 milligrams of salt in any given day. Honestly, if you can eat less than that, that's probably going to be the best thing. And one of the biggest ways that we can do this is not only by limiting your salt intake with the supplemental salt that we put onto our foods, like we would here, for instance, if you were eating something like French fries or maybe certain types of vegetables. We know that as healthcare providers, we have to be realistic. Patients are going to want to eat and they're going to want their food to taste good. And adding salt is one of the easiest ways to give your food more flavor. But if you were told that you have high blood pressure, and especially if there is consideration for, or if you're actively going to be taking medications, you do need to think about the supplemental salt that you're adding to your food. But not only that, when we talk about the DASH diet, we're also looking at other sources of salt, or it'll also be referred to as sodium on the packages of most of your foods that are in the food itself. This will commonly be the case if you're eating things that are frozen and need to be preserved, basically. A lot of times, products that either contain salt or salt outright itself is going to be used in these foods. Canned foods also are another source of getting excess salt in your diet. Certain other things as well, including beverages, you have to be very careful of. So when we talk about the DASH diet, even though we do keep an eye on your salt intake, we're actually looking at you getting healthy foods into your diet. And so this is something that we're going to talk about in today's video, is that the DASH diet is more than just about looking at your salt intake. It's also about eating certain types of foods in certain quantities and making sure that you're eating the healthiest diet possible. One of the ways that you can find out if you have high blood pressure whenever you go to an appointment is that your provider, whether it's a physician, a nurse practitioner, or a physician assistant, or a pharmacist in certain cases will sit down with you and talk to you a little bit about certain things that they've evaluated. Frequently, what we'll take a look at is things like your lab results. We'll look at how your kidneys are functioning, and we'll look at certain things called electrolytes that you often see anytime you have blood work done that are included in your results and what those results look like. We may also take a look at certain other factors like your blood sugar. It's not uncommon for people that have type 2 diabetes to also have high blood pressure and need to be treated for it. As part of this video series talking about diets associated with good health and with certain chronic conditions, we're looking at DASH diet today, but we'll also actually take a look at diets that are beneficial for high cholesterol, patients that have high blood sugar and might have diabetes, and different things that you can do diet-wise to try and help with that. In the case of the DASH diet, that's something that we will take a look at. You will have your labs monitored. We will encourage you to do certain things at home that we're going to take a look at in just a moment, what some of those things are, and talk to you about your diet. We may also place you on certain types of medications. A lot of times patients will often find out that they have to take one particular medication at their visit. Months will pass, they come back, and we check you again, and then we may recommend another medication. And oftentimes, by the time I walk into the room to speak with the patient and do some education, I often get questions about things like, why am I having to take so many medications? As we'll talk a little bit about in the diabetes video, and also when we talk a little bit more about general heart disease and certain things associated with that. In this video relating to blood pressure, the reason behind all of the different medications and why we tell you to be careful with things like your salt intake, and we'll look at some of the healthy foods you're encouraged to eat as part of the DASH diet, is because your blood pressure could be affected by a number of different things. As I mentioned, diabetes and risk factors for it or outright having it is unfortunately very tightly associated with various things with your cardiovascular system. So it's not uncommon for patients that have diabetes, because of the amount of sugar circulating in your body, it's going to affect other parts of your system. So your heart is one of the most common places. Other areas like in your hands and feet, your eyes, there are certain areas that are unfortunately quite predisposed to some of the harmful aspects of too much sugar being in your body. You could also have high blood pressure because of things related to your kidneys. So it's not uncommon for kidney issues to either cause high blood pressure or the other way around, for you to have high blood pressure and that will need to be keeping an eye on how your kidneys are doing. It could be something that is hereditary, basically referring to the fact that if members of your family, especially people closely related to you, have high blood pressure, it's unfortunately a very high statistical likelihood that you as an individual may end up with high blood pressure as well. It can also be stress. So when we talk about lifestyle modifications, it's not just about taking into account how much salt you're consuming or eating healthier foods, but good stress management techniques are also going to be incredibly vital for you to be able to keep yourself calm, relaxed, and by extension, keep your blood pressure low. And these are certainly things that if you go into an appointment and you're told that you have high blood pressure and you need to do certain things to change how you're living, these will be things that you might want to talk to your healthcare team about to find out what's the cause of your high blood pressure and what sorts of things can you begin incorporating into your routine to have those healthy lifestyle modifications to make you get the best result with or without your medication. So these are just some things to think about as you go into your appointments. Remember that if you like our content here and you want more information, to like and subscribe to our channel. We're going to have a lot more great videos about this. And if you take a look in the description below, I give some more information about some of the things that I've mentioned here, like the amount of salt that you should take into account if you're doing a DASH diet and if you're on any sort of blood pressure treatment. And I'm going to recap some of the foods that we're about to look at as part of a healthy diet. So like I mentioned, with a DASH diet, it isn't simply about your salt intake, it's also going to be about incorporating healthy foods and also ensuring that you're doing certain things when you're at home to track your blood pressure and to make sure that you're getting the best possible outcome, whether you're on medication actively Or if you've recently been diagnosed and you're trying to manage your hypertension or high blood pressure with lifestyle modifications like diet, exercise, which is also another really important component of the DASH diet. If you can manage it anywhere from about 30 minutes to 60 minutes, a few times per week, so that you can get your body again into the best shape possible. And again, stress management, meditation, exercise, all of these are techniques, and they're all recommended as part of a great regimen that includes the DASH diet. So all of these things will work together, and right now we're going to take a look at some of the things that you can do food-wise to make sure you get the best results using the DASH diet. When most people think about a DASH diet, the first thing that will typically come to their mind is this guy. With salt, it is true. One of the major characteristics of the DASH diet is that you want to keep your salt intake, or you'll hear us refer to it in medical terms as sodium intake, to as much of a minimum as you possibly can. With the DASH diet, what's generally recommended is about 1,500 milligrams to no more than 2,300 milligrams per day of sodium. If you can keep it on the low end, that's going to be the best option that you can possibly do. What determines how much sodium you should have, could even be lower than that, is going to be what it is that's causing your blood pressure concerns, whether or not you have other health conditions. The best way to determine how much you should limit yourself to is going to be to have a conversation with whomever it is that is following you for your blood pressure issues and is giving you the medication. With regards to other things that we can do to try and help ourselves, you're going to have more than likely the use of this. So with a blood pressure cuff, this is going to be very helpful because you can track what your readings are like at home, and this will help you to be able to tell if your medications, as well as changes that you're making, such as reducing salt and eating a healthy diet, are going to be helpful enough. This is one of the more higher end, fancier ones in terms of the home use products. You can certainly go with this brand. This is not any sort of an endorsement. They do tend to be very reliable and one of the top selling ones in terms of what you can walk into a pharmacy and purchase. But there are other very fine choices that you can go with from stores like your pharmacy, a larger chain store. So as long as it's something that's giving you fairly reliable and consistent readings, you can pretty much use this brand or any other brand. But tracking your blood pressure readings at home once you are given a medication and once you start making adjustments like decreased salt and eating a healthy diet is going to be very crucial. So again, this might be something to talk to your healthcare team members about, but having a blood pressure monitor for your home use is probably going to be a pretty good idea. There are different options that you can use when you're going to the supermarket to purchase different types of vegetables. One of the more popular things is to go with some of the pre-cut varieties that are like our friend here, that are already packaged up for you with a little kit. These are great because they are something that's helpful if you need motivation and know that having to create your own salad by cutting up things like this is going to be difficult for you. The one big area of caution, however, with some of these pre-cut and packaged salads, especially the ones that come like this as a kit that have salad dressings in them, is the whole issue behind a DASH diet is to control your sodium intake. So you just want to make sure that if you're getting one of these kits, that you take a look at the dressing. And in this particular case, not to incriminate our friend here, because I love that type of salad dressing, you want to make sure that you're mindful of the sodium content in it, which typically on the backs of these packages, they're going to let you know what your sodium intake is going to be like. And you want to make sure that you're looking not just for things like the components associated with the salad itself, but be very mindful about the salad dressing. So whenever they tell you your serving size, you want to make sure that you keep that in mind and also think about that for the dressing itself. If you know that you might not be able to manage the temptation of putting that entire lovely packet of salad dressing on top of your salad, then going with some of these are going to be better options where you're purchasing actual whole vegetables and then slicing them up yourself and selecting maybe different types of dressings that you can use as the topper for your vegetables. Other options are going to be things like other greens, whether it's Brussels sprouts or if it's string beans, but having fresh vegetables is going to be a very important piece. Here is where I would want to put a little indication for you of just being careful of frozen vegetables. Again, just like how it's convenient with our friends here, the cut kits of salad, using frozen vegetables may seem like a nice shortcut. With frozen vegetables, just like we talk about as healthcare team members with canned foods, you want to make sure that you look at sodium content, because again, our friend here, salt, is going to be the thing that you want to be careful of whenever you're making choices. Fresh fruits are also going to be very important. You want to make sure that you're incorporating them into your diet as much as you can. And again, as much as you can do fresh fruits here, whatever is in season at your supermarket or at the market that you go to, you want to try to make sure that you're working some of that into your diet a couple of times per day. You want to be mindful, if you have things like diabetes, the amount of sugar content that you're getting from fruits, and be careful if you're looking to substitute things like smoothies or juices into your diet. Smoothies are probably your next step from eating the whole fruit like this, because the smoothies will have a certain amount of the fiber content, which is going to be helpful for your GI tract and for certain other components related to your digestion, as well as just your overall health. But with juices, you're getting the straight sugar content. So again, what we unfortunately see is that with many people that have hypertension, they'll also have concerns for things like diabetes, or having excessive weight, or certain types of cardiac conditions, where you want to make sure you monitor your sugar intake. The last groups of food that we want to take a look at are here. Your oats, for instance. Whole grains are going to be really important as well. You want to make sure that you're getting as many good sources of whole grains as you can. You have instant varieties like this. You'll notice here that I try to purchase the unsweetened one. Again, like how we have with the salads, with oatmeals, it's not uncommon to see them come pre-formulated, if you will, with sugary additives and things like that. That's something that you want to be careful of. And again, because we're on a DASH diet, you want to make sure you always look at the sodium content with any foods you're selecting. Dairy products are another area that you want to try to make sure you watch. So unlike what we've been looking at here with vegetables, fruits, and whole grains, with regards to dairy, they sort of fall into the same category as their buddy, salt. With dairy in the DASH diet, you want to keep dairy to a low level. What a low level constitutes is really going to sort of be contingent upon you and your health. So with regards to this, if you take a look in the description below, there are some nice resources here in our references section that give ideas as to what constitutes things for the DASH diet, including nutrients and additives and things that you're going to benefit from with the types of foods you eat here, and also the breakdown of your calories that you're going to be consuming, how much sodium that you're going to be taking in, and what might be advisable in terms of how much dairy to consume. But just in general, dairy products are usually seen as something that you want to keep to a quote-unquote low level when you're going to be engaging in the DASH diet. The final component is going to be meats. And in particular, you want to go with lean meats. Here you'll have thin sliced chicken breast as an example. There are certain other options of lean meats, including for those that like red meat. There are certain types of cuts of meat or amounts of fat that are removed from the meat that might make beef something that you can consider. In general though, again, if you look in the reference section, we'll talk about some of the options regarding what some of those lean meat choices might be. But you just want to make sure that you try and consult, if you have a healthcare team helping support you, whatever it is that they advise, to be able to help you make good choices. So that's the DASH diet. Just to recap some of the things that we want to keep in mind. Remember that depending on your particular health condition and the advice given to you by your specific healthcare team, which may include a dietitian or nutritionist, no more than about 1,500 milligrams to 2,300 milligrams of salt intake, and that includes from all of your foods. This is why, as we just talked about, fresh whole vegetables, fruits, lean cuts of meats, whole grains, things that stay away from being frozen, canned, or preserved in other ways are going to be crucial. Like we mentioned, things that are preserved and are not fresh are also going to have their own amount of salt in them. And then if you add salt on top of that, you'll very quickly run through that 2,300 milligram top amount in no time. You also want to make sure that you limit your dairy intake and talk to your healthcare team about what sorts of dairy products might be good for you, whether whole dairy, partial quantities, or skim. Picking the right one for you and making sure that you keep it in low amounts and what those low amounts are for you are going to be key. And checking your blood pressure. If you can, getting a trustworthy monitor to use at home. And keep a journal about the things that you're consuming along with your blood pressure readings. It's really helpful for us anytime you come in for an appointment for us to be able to see what your readings were that day and anything that you had to eat. Maybe you had a cheat day and you went out to your favorite restaurant and you had something that was high in salt, or you're on vacation. All of those bits of information are so helpful for us to be able to have a great discussion with you, and we'll be able to keep your goals in mind as well. So having that two-way communication is going to be so important to being able to keep you living well and healthy. So if you're ready to incorporate the DASH diet into your routine, it's something very easy and very doable. And if you have high blood pressure, and as we'll talk about when we look at the diabetes and the other heart disease conditions, particularly high cholesterol, you can incorporate the DASH diet there as well, because it's something that incorporates eating whole, healthy vegetables and fruits and low quantities of fats from things like meat and dairy products. It's very beneficial. While the DASH diet is tightly associated with high blood pressure, it's actually helpful for people that have diabetes and high cholesterol as well. So if you're ready, start incorporating that. But again, remember as always to speak to your healthcare providers before you make any major changes in your diet or your routine to make sure that it works for you. So remember again, if you liked today's video, please like and subscribe to our content. And remember to check out the description below the video for a lot of information that we talked about in today's video, as well as some great resources that we have from our references that were used to prepare this video that have excellent patient-facing information that you might find beneficial. We look forward to seeing you with our next video here at Lotus Health Education and Wellness, where we provide empowerment through health enlightenment. Take care.